মাঝে মাঝে আমি নিজেকে প্রশ্ন করি, এই সিগারেট বা বিড়িটি খেলে আমার কি ক্ষতি হবে?
Tobacco kills 8 million people worldwide each year, which is more than the combined deaths from AIDS, tuberculosis, and malaria. In Bangladesh alone, 161,000 people died from tobacco use in 2018. These figures are not just statistics. They represent a significant policy failure that requires examination. Let's explore why Bangladesh's primary strategy against tobacco is fundamentally flawed. The Tobacco Survey 2017 shows that 37.8 million adults use tobacco in Bangladesh. The country is currently facing a public health crisis of unmatched proportions. The government's response has been predictably narrow: raise taxes and hope for the best. However, with 161,000 annual deaths from tobacco-related diseases and thousands of people rendered disabled, we must ask, is this strategy really effective? Data from the Bangladesh Cancer Society indicates that in 2017-18, tobacco generated 22,810 crore taka in taxes but caused economic damages of 30,560 crore taka. This results in a net loss of 7,760 crore taka, equivalent to 1.4% of our entire GDP, disappearing into thin air. Yet, policymakers continue to promote tax increases, as if repeating this approach will somehow change the mathematics. Between 2009 and 2022, Bangladesh experienced a 13% relative decline in tobacco use, despite consistent tax increases. However, given this trajectory, achieving the goal of being tobacco-free by 2040 now appears statistically impossible. Why do these taxes consistently fall short? The answer lies in a complex market response that policymakers have largely overlooked. Bangladesh has a four-tier cigarette system that creates what economists refer to as substitution elasticity. When premium brands become too expensive, consumers simply switch to lower-tier options. A report indicates that low-end cigarettes now control over 65% of the market, serving as an escape valve for price-sensitive smokers. The tobacco industry has not only adapted to tax policies but has rendered them ineffective. The most concerning finding is that the Bangladesh government owns 9.49% of British American Tobacco Bangladesh. This situation creates a contradiction. While we are trying to combat tobacco consumption, we are also profiting from tobacco sales, which undermines the credibility of our policies. Experts recommend simplifying the four-tier tax system to two tiers. The change would remove the price differences that make tax policies less effective. However, this is just one part of what needs to be a complete solution. Successful tobacco reduction programs in other countries show that we must take action on several fronts at once. This indicates selling of government tobacco investments, helping tobacco farmers switch to growing other crops, regulating manufacturers who do not register, and most importantly, treating this issue as a communication challenge rather than only an economic one. The goal of a tobacco-free Bangladesh by 2040 is possible, but we must stop believing that taxes alone can change behavior. To make real progress, we need to recognize that complicated social issues require complex solutions, not just simple financial fixes.